Assalamualaikum. In this video, I am discussing a communications that is bone marrow aspirations and also bone marrow biopsy. These are similar, just one line we can change. So bone marrow aspiration and bone marrow biopsy communication. It is also a consent scenario, and as usual, IRCAP. After that, I explain, like as you see, he has complaints. We want to be sure that of what behind all this and AC's response to medicine. For this reason, we are doing to a procedure, or our consultant has taken a decision that is called, suppose bone marrow aspiration, I am telling. So the procedure is that we will use aseptic needle to take a small amount from inside the bone marrow fluid of pelvis called hip bone, that is iliac crest. We show this, that is the pelvis from the hip bone after cleaning, and putting local numbness cream inside this bone. There is what we called bone marrow, and it is the factory of doing the blood cells. So there is chief complaint. So we will do by aseptic procedure. We a very small needle we inside the our hip bone, and we collect some fluid from this bone marrow, which is called factory house of the blood cells. If the communication is biopsy, then we tell that same procedure, some tissue or a core of the bone marrow in one piece of bone with marrow and turn check under microscope. So we are just a core or a piece, small piece of bone with marrow we are taking and taking under microscope. What is the benefit of this procedure? The role player can ask. So we will examine the samples under microscope to find out what is the cause behind his complaints. We may need sleeping medicine if child not cooperative. So under microscope we see that what is behind. What are the risks or drawbacks of this procedure? It done by expert team. They deal with any pain, apply the numbness cream. So the problem, if there is a pain, numbness cream we apply and we give painkiller after. It can be bleeding occur. We also handle this if catching bugs, but we are doing it under clean conditions. Sometimes it can be failure occur. The next question, can doctor by mistake enter inside the bone? So I appreciate your concern. We tell like that. It is done by expert team, and has it done many times before. Is there any alternative available or not? No, we need to know what happens in the factory of the blood cell. So there is no alternative of the bone marrow aspirations or biopsy. Is he going to bleed? We advise to lie on the bed and observe for an hour to check he has no more bleeding. And if this happen, usually minor and stop sometimes. So the rule player may ask, there is bleeding occur after or not. If there no, he will be take rest. If there is bleeding, it will be minor and will take proper procedure. What about his activities after that? So he can return to his daily activities and swimming, everything within 24 hours. When the result will be released, as soon as the result is published, we will inform you. Normally it takes usually 2 weeks, but we will not mention the name, mention the time. We just tell when result published, we will inform you. If the patient role player is still refused, arrange another meeting with the consultant, but sooner is better for starting the treatment early. Okay, then summary leaflet, support group, these are as usual. Like if she take blood thinning medicine like aspirin she is taking, then we'll stop this medicine. Remember this line. And the role player can tell that my child will be die because he has something leukemia type conditions. Then we'll tell the answer like that. Fully appreciate, reassure him. Until now we still suspected the conditions. We are not sure. Even if she has leukemia, curable rate is very high. So we still suspect the conditions. We are not sure. For sure we are knowing that if the condition develop, modern technique or modern treatment is high, curable rate is also high. So this is all about bone marrow aspiration or biopsy communication. Thank you.